In this video, we provide an introduction to Lehigh University Autism Services. Our services are rooted in the evidence-based practices and the science of applied behavior analysis. We provide applied behavior analytic-based therapy. ABA is the science of behavior change and helps us understand how to improve behavior. There are several different practices within the science of ABA, including naturalistic developmental behavioral interventions, pivotal response treatment, and positive behavior intervention and supports. Applied behavior analysis is the science of behavior change. It helps us understand how to teach new behavior and improve behavior. This science emphasizes that in order to understand behavior, we must understand what comes before and after it. This is demonstrated by the A, B, C sequence. The A stands for antecedent and is the event that happens immediately before the behavior. The B stands for behavior, which represents the behavior of concern, or the behavior targeted for change. The C stands for consequence, which is the event that happens immediately after the behavior. An example of an A-B-C sequence may be that the A is a parent asks their child to clean up their toys, the B is the child throws their toys at the wall, and the C is that the parent begins to yell at the child. We use this ABC sequence to better understand why a behavior occurs so that we can develop programming to prevent challenging behavior and promote desired behavior. Naturalistic developmental behavioral interventions are derived from both applied behavior analysis and developmental psychology. NDBIs are research-based interventions that combine components from both fields to most effectively help children. These interventions focus on increasing and improving developmentally appropriate and socially valid behavior for young children with autism. Pivotal response training is a naturalistic behavior treatment for autism that is play-based and child-initiated. There is an emphasis on pivotal areas of a child's development. The idea behind it is that by focusing on pivotal areas, PRT produces improvements across other areas of social skills, communication, behavior, and learning. Some examples of pivotal areas include motivation, self-management, and initiation of social interactions. Positive behavior intervention and supports is a tiered approach rather than a therapy or treatment. PBIS can be used to improve safety and promote positive behaviors. It focuses on teaching children expectations. It is prevention-centered rather than punitive in nature. PBIS helps us decide how to respond to a child who exhibits challenging behaviors in order to teach them what is appropriate. This is a list of some, but not all, commonly targeted skill areas. As you'll see on the left, there are many different language skills that we often work to increase with our clients. On the right, you'll see many different adaptive skills that we focus on as well. As noted on the previous slide, we emphasize the importance of communication and language-related skills in our programs. This is because language is often a primary need for children with autism. In addition, teaching language skills helps children increase their independence in a variety of contexts, such as social conversations with peers and requesting help from a parent or teacher. Finally, teaching language can also improve challenging behavior. When a child has difficulty communicating a need, they may be more likely to engage in challenging behavior. Teaching them a way to communicate is likely to aid in decreasing the rate of that problem behavior. Before we begin teaching language, we often work on teaching children precursor skills to language. One primary precursor is the ability to imitate. Imitation involves copying the movements of another person. Imitation is important for language development because it allows us to learn new things quickly by watching and copying those around us. By working on imitation skills, it can help a child learn to imitate sounds in order to vocalize words. To conclude this video, here is a summary of what we do at LUAS. We implement a variety of evidence-based practices which are rooted in the science of ABA with a strong focus on language and social communication development. We also work with families to collaborate on goals and find the strategies that work for them and their individual preferences and needs. Thank you for watching.